if you had told me 4 years ago that we were going to have a global pandemic and that we were actually in this country going to be, there are other contexts as well, but we can see this happening. But in this country, that we were going to be arguing about whether or not to wear masks, that we were going to have vaccines, and we were going to be politicizing whether or not we should get a vaccine, I would have told you, even in the crazy divided world that is America today, that can't happen. Hello and welcome to the New Conversation. I'm Dwight McBride, president of the New School. We're so grateful to have you join us for this series where I converse with distinguished thinkers, creators, and doers about the critical issues of our time. Today's guest is Dr. Vin Gupta, a renowned physician, health policy expert, and professor at the University of Washington. Throughout the COVID-19 pandemic, he's appeared on television and in publications across the country to share science-backed information and analysis. I think this is a great moment to talk about what he's seen over the last 2 years and what we should be thinking about in terms of where we stand today. Vin, thank you so much for being here with us.
President McBride, it's so good to at least virtually be back in New York City and with you. It's a true pleasure. Thank you for having me.
Well, I'm going to dive right in because I have a lot we want to cover today. Certainly a lot's happening in your world and in our world around the prime issue. But before we do that, really wanted to just ask you a question I ask everyone who sits in this chair, and that is, when did you know that you were going to be a doctor? Was there a particular moment in your childhood or as a young person? And was there anything else that you thought you might be other than a doctor at any point?
It's I think especially coming from South Asian heritage, where medicine is, it's almost a foregone conclusion that it needs to be on your short list of occupations to consider. I was reared and my mom is a neonatologist, and she raised my brother and I, who's also a physician, almost single-handedly. And so we spent a lot of time in hospitals. We grew up in Toledo, Ohio, countless trips back to India. And so my touch points with medicine were visceral from a very young age, lots of times just in waiting rooms, post-school in her office. And none of that really clicked or connected. I can't say I had a deep, profound sense of what she was actually doing early on. But it was those ingredients there that over time I was able to connect all the dots, and I realized what she was doing was actually just incredibly impactful at the individual level. She came here, was able to impact the lives of her of families that really trusted her because she was caring for really sick neonates, and the degree to which those individuals' families would come to our house, drop off presents or baked goods on the holidays. I think what really resonated with me was not that she was necessarily a physician, but the impact she had emotionally on these families. And over time, that stuck with me as I was navigating high school and college and those experiences. That's really hard to replicate in other industries.
Yeah, absolutely. Well, you didn't just pursue medicine, though. You've got these 2 extra master's degrees that you picked up as well. One in international relations from Cambridge and one in public health from Harvard. Is it that you just love school, or was there a plan all along the way for how all of this was going to work together?
I would hope most docs and healthcare providers will agree with me when they say that they want to get out of an academic environment, or at least a training environment, as quickly as they're allowed to, because you're accruing debt, probably not making a lot of money to be able to clear that, plus your living expenses. So for me, it was less about being in that environment, kind of just amassing degrees or having some grand strategy, which I did not. But it was much more about truly following a path where I didn't feel like I had a mentor. Where my interests were diverse. I was a military doc for a bit. I had spent a few years in medical school at Columbia, actually, which really fostered this sort of global thinking. And that's why I followed a path that imparted some diverse skill sets, but I wanted to be able to speak to different sectors, be able to synthesize different threads across different sectors. And it took a respiratory pandemic, Dr. McBride, to make it all make sense.
I was about to say, it actually comes together really nicely given the work that you've been doing over these past 2 years, especially. And I'll ask you to reflect on that in a moment too. But before I do, just want to move into actually thinking about this moment that we're living through. As we tape this, we are now more than 2 years past the initial lockdown. So we can say that we're probably as much as 2.5 years beyond the time that we've been grappling with this. As you look back, what are your thoughts about what we got right and what we got wrong? And I'll add on to that, apropos of what you just said to us. How is in some ways the unique preparation that you've had in terms of schooling and training prepared you for the work you've been doing these last couple of years?
Yeah, gosh, I will say in terms of what we got right, giving credit where credit's due, I will say the Trump administration's focus on Operation Warp Speed, trying to break down bureaucratic barriers when it came to governmental funding for different diagnostics, therapeutics, vaccines. There were mistakes, don't get me wrong. I think we can probably cite several in terms of initiatives or products that were funded that shouldn't have been. But without that removal of red tape through this cross-governmental initiative, public-private partnerships, we would not have averted 2 million plus American deaths through wide disbursement of these great vaccines. So that we got right. And yes, that could be optimized, hopefully in the future to be even better, more efficient, but that was terrific. What we got wrong is, and this goes to your last question a bit, is I don't think those of us in healthcare or our establishment, the healthcare industry in general, is all that adept at self-awareness and reflection about weaknesses. Mm-hmm. And there's a lot of us, a lot of my colleagues, especially those with gray hair, who equate effectiveness to how many grants they've received from the NIH, how many papers have their name on it. And while that is one marker of influence and success, it's not necessarily correlated to being an effective leader or a great crisis communicator. Yeah. And we didn't have a bench of those individuals with diverse experiences that could step up, especially at the highest levels. And we paid the price. And it took many months. So much of the aggrieved feelings were directed towards our former president, appropriately so, in many cases. But if we're being self-reflective, we could have done a lot better job discussing why it is you get vaccinated against a contagious respiratory virus, distilling this information down through helpful visuals, making these concepts simple. We need other institutions to really step up to train the next generation of healthcare leaders to have a diverse skill set. Which brings me to why I felt well positioned, because I, if anything, and for your students that may be listening, don't fall victim to dogma and what you think and what others tell you should be doing if you want to pursue, say, a career in medicine. There are different ways to have impact.
And it's so true what you say. It's not only creating that next generation of healthcare professionals, but also of informed journalists, right? Informed policy analysts, people who really play important roles in how the public receives information, right? How the public is educated about something like a pandemic, right?
Oh, absolutely. And yet I think I couldn't agree with you more, President McBride. And yet you take the oxygen out of misinformation if you're a persuasive health communicator. Yeah. If you can land a message that is convincing and persuasive, even to those that are likely to be skeptical, it makes the ability to distort that information or to run with some silly headline, it makes it less likely. I'm not saying it eliminates it, but we are not or you don't get taught how to be a good persuader in medical school. You get taught how to be empathic at the bedside, but two very different skills.
Well, listen, you're to this point, you're a pulmonologist by training and not an epidemiologist. But become a very public figure discussing the facts of COVID-19. And I read that in 2020 alone, that you conducted hundreds of television interviews. I got to see some of them myself about the pandemic. We knew so little, and this was happening, from our perspective so quickly, right? And we knew so little about what was going on. And there was such distrust in some ways of what was coming out of the White House. People were looking for places, for people, for information that they could digest, understand, and that they could trust. And I think not only were you a big part of that, Dr. Fauci was a big part of that. There are others who became quite well known through this work. And you were also fearless in taking on a lot of public figures who later became anti-vaxxers, and even earlier anti-science, right? Who just were not leaning into the actual, this isn't political, it's an epidemic. This is a virus, right?
Yeah.
What was that experience like for you? And where did that courage that I experienced, so many of us experienced on air by you and others, what was the source of that for you?
I will say that I felt emboldened or empowered to be able to take on silliness or nonsense, outright nonsense, because I felt in some ways that we were on my turf from a clinical scientific standpoint. These issues that exist vis-a-vis COVID, a respiratory pandemic that causes critical illness, it is so core to what I've spent years training to be an expert in, that I relished the ability or my position to be able to leverage the credibility that gave me to really call balls and strikes. But I was careful, because what I tried not to do was step out of that. When I saw somebody make a silly take on masks or on the pandemic itself, I recognize, here I am with this platform. I'm privileged to have it. I feel like there are a few folks with either the set of skills or or experiences to be able to really leverage that platform to push back. And I felt empowered to be one of those individuals. And so that's when I would occasionally call balls and strikes, because I thought that was my responsibility. I try not to overdo it, because I think if you're the individual that's constantly calling balls and strikes, constantly putting out information or criticizing people, then I think you lose some luster and you also lose credibility. So there is a sweet spot where I've tried to largely err on the side of just informing and being an accessible doctor, giving medical advice one-on-one when I can, and on air, but to push back when needed. And I think that's part of the role and the responsibility.
As we talk today, we're a day after, I think it is, that a court in Florida literally struck down the CDC mandates around masks. And I wonder, going back to this issue of the politicizing, if you will, of the pandemic, are we there? From your perspective as a physician, as a scientist, are we there? Is that the right move for us to be making in this moment?
I think this sets a really very scary precedent that one federal judge and an appellate court in Florida can just take down an entire federal mandate issued by the CDC's recommendations in a public health emergency. That's an astonishing precedence that, if the Biden administration lets stand, would mark a really, I think, pivotal point in this pandemic, because then what influence, what power does the CDC have in the future to be able to take a similar action and when necessary, if courts will feel absolutely no deterrence to then strike it down the next day. There needs to be some deterrence here for this type of action, if only because the federal judge, just to dive a little deep on what this judge did, they distorted the definition of sanitation, saying that masks are not required to create a sanitary environment, thinking that sanitation only means Clorox bleach wipes. That is such a narrow, confused, distorted view of that concept, and it's wrong. Sanitation is anything related to infection control. We now know masks are critical to controlling the spread of COVID-19. So this is something that can be easily pushed back on. The question will be, will they do it?
Right.
Recognizing that having people mask up again on airplanes might be a political nightmare for them at this point, especially if they're going to let it lapse anyway on May 3rd. So this is not as simple as I'm putting it out, but from my perspective, if they don't push back, it is setting a terrible precedence.
It's a good note to have out there in the world, because I agree with you. The precedent that it sets worries me too. Let me ask you this: if you could say anything to people, to the public, especially those who are opposed to vaccines, about the moral and emotional dimensions of vaccines, what are you saying today?
Right now, what I personally seen as an intensivist from a moral ethical standpoint is, as recently as the end of February, our hospitals, whether deployed for the Air Force down in Tucson or up here in the Pacific Northwest, without a shadow of a doubt, every hospital was overcome with COVID-19 patients, whether in the emergency room or in the ICU, and the vast majority of those individuals were unvaccinated. So what you hear on TV, we lived very viscerally. And what does that actually mean? That in our ICU, as in any ICU in any zip code across the country, is a mixed ICU. There are some folks that are for medical patients, but many are surgical. Right. Many got that knee replacement or had an elective surgery that they've been putting off. Now you continue to delay it. That's the first thing, President McBride, that gets shut off is elective procedures that are still really important. Yeah. So people are suffering. There's long wait times in the ER. And so from a moral ethical standpoint, somebody who thinks their decision to remain unvaccinated somehow is theirs alone, they're fooling themselves. It impacts the health of that community. It absolutely impacts, we're seeing downstream, a hospital's ability to care for those individuals who did get vaccinated. Now we've seen many cases, not only for elective procedures, but for appendectomies that have been delayed, people having adverse outcomes because their pneumonia didn't get treated in time, non-COVID pneumonia in the ER because the beds were full. This clearly has downstream impacts even on those that are vaccinated, which is why I've long believed that advanced interventions, things like, for your listeners, something called ECMO. It's called extracorporeal membrane oxygenation. We don't talk a lot about it, but it's something we use in the ICU a lot, where we have it. It's this really scarce resource that takes the blood out of the body, sends it to a machine that oxygenates that blood, and then that machine sends that blood back through a large IV into the body. I mean, it's really extreme stuff, but we use it if the ventilator isn't enough. And that resource can save lives, but it's human intensive. There's a lot of capital infrastructure that's needed to support it. And the supply is always less than demand. And yet the vast majority of people that have been utilizing a scarce resource up to now have been unvaccinated folks, even though we need this resource for folks that are vaccinated that might have flu or any other number of conditions. We need to start thinking broadly for the next pandemic, and surely there will be another threat. How do we start allocating these resources based on people's personal decisions? Organs, so somebody's liver, if you need a liver transplant because you drank your entire life, you can't actually get listed on the organ transplant list unless you've been sober for at least 6 months. So personal decisions should impact how people interface with healthcare, especially for rationed services?
Something I've been thinking a lot about are the long-term effects of COVID, and not just of the virus itself, but of the pandemic as a whole on our society. The isolation we've experienced, the fear, the loss, the lingering mental health issues. I wonder what your thoughts are about that, and also about frontline healthcare workers. My sister is also a nurse, and I've watched what they've been through in our home state of South Carolina. They've carried an extraordinary burden, many of those healthcare workers, to get us to this point. How do you reflect on that broader long-term effect of the pandemic on our society?
I'm glad you raised this. I think on the medical establishment side, say on our healthcare workers, docs, nurses, therapists, there's one clear trend, and it's in a really scary direction, which is we're going to lose 40% of docs, 30% of nurses, an untold number of respiratory therapists by the end of the decade. They're leaving the workforce for good, either to attain an medical adjacent field, or they're just leaving the workforce entirely because they're burned out. They don't feel, in this case, nurses, for example, or wage workers don't feel like they're getting adequately compensated. A nurse that's a military nurse in the reserves gets hazard pay if they get deployed for COVID. But that same nurse in their civilian duties doesn't get hazard pay. Doesn't make any sense. We're going to see this trend continue. COVID it was already existing prior to COVID. COVID has hastened it. We don't have enough nursing seats or nursing students in nursing seats, medical students in medical schools to replace that. So how do we do more with less, care for more people with less workers? There's a lot of potential solutions, but none of them are being adopted by Congress. I think technology may help with this problem, but we are in loads of trouble given this supply-demand asymmetry. Lots of demand for healthcare services, not enough workers, especially by the end of the decade. In terms of our society, though, what has always alarmed me, even right now as we're talking about unmasking in airplanes, is 6,000 people just died last week from COVID.
Yeah.
And the tolerance for, I think just 4 weeks ago, 20,000 people were dying week over week, and we were having active discussions about when governors were going to unmask schools, when 20,000 people just died in the middle of February of 2022. The tolerance for loss of life here has stunned me. That personal exhaustion with talking about COVID has taken a greater priority. Sort of those who are privileged enough to be safe from the worst impacts of COVID, to be able to work from home, as an example, are the ones that are often the loudest when it comes to removing the restrictions on airplanes, when it comes to masking, or you name it. And yet they're not the ones bearing the brunt of the health impact. And the health impact has been extraordinary. So hearing from the privileged crowd that has not necessarily had to interface with COVID nearly as much directly or been impacted by it, that these restrictions are unjust, when at the same time we're seeing such an extraordinary loss of life, that dissonance to me doesn't portend well for how we think about collaborating and responding to the next crisis. And certainly our lack of crisis communication, all the ingredients to an effective future response to the next pandemic. I don't know if we've actually learned the lessons of the time. We're diagnosing them. You and I can talk about it.
Sure.
But are we actually building a bench of crisis communicators? Or are we doing the things that we need to do to recruit more healthcare workers and retain them? I don't believe we are. So there's a big gap between what we acknowledge as a problem and what we're doing to solve it.
And to your point, I think the thing that if you had told me 4 years ago that we were going to have a global pandemic and that we were actually in this country going to be, there are other contexts as well, but we can see this happening. But in this country, that we were going to be arguing about whether or not to wear masks, that we were going to have vaccines, and we were going to be politicizing whether or not we should get a vaccine, I would have told you, even in the crazy divided world that is America today, that can't happen. I mean, I literally, it was unimaginable for me. And I have to say, I've lost a little bit of faith in my fellow humans as a result of this too. And someone in your role, and how do you keep moving forward and doing the work when you've gone through this experience that has been so stunning in terms of some of the human response to it and the tolerance, as you put it, for for tragedy and death?
I think that was beautifully stated. And I'll say that, I've gotten this question before. I've realized that there's probably never been a more important time than now for me to quote unquote stay in my lane and just be a doctor or reassured as many people as I possibly can. That's probably the best way I can have impact at the individual level and at scale, that if people can feel like they can trust me across the screen or on social media, if they have a question, that we don't have enough of that right now. We have a lot of doctors out there who want to talk endlessly about should or should we not be unmasking our children in schools. And that drives me crazy.
I want to switch gears really quickly, and you mentioned technology, and I want to talk a little bit about healthcare and technology. You're a big proponent of including more technology, including home and smart devices in medical care, so that doctors have access to individual health and patient data that could help with better diagnosis and treatment. Can you talk a little bit about why that's so important to you?
Well, given the dynamics we just talked about, the fact that we're not going to have enough medical providers by the end of the decade, even as our population ages and grows larger, is a big problem. And Congress, it's not like Congress is going to start to agree on anything anytime soon to remedy this issue. So what's the one off-ramp here from this crisis that can help us? It's technology. It's thoughtful adoption of medical technology to help people access care where they need it at a lower cost. And that's where I think telemedicine, which has been given an enormous boost from the pandemic. I mean, if there has been one silver lining to this pandemic that we should all feel heartened by, it's that I do think our healthcare system, even with these healthcare worker crises on the horizon, I think our system has become much more modern, more progressive in thought when it comes to policy. And that means good things. I mean, think about this, President McBride. 12 months ago, we didn't have a test for an infectious disease that ever existed that that you could use to sense for COVID-19 within the convenience of your home. This sort of thought about rapid testing at home, the technology didn't exist. The FDA didn't even have the policy framework to allow for it in the home setting in December of 2019, much less in December of 2020. Innovation has occurred, technological and policy, to unlock these services that now we don't even think twice about. Oh yeah, I'm going to test myself for COVID. It's almost a foregone thought. 12 months ago, it didn't exist. Lots has happened, and I believe that if we make telemedicine through smart devices or through the telephone more accessible, if we allow for cross-state licensure of practice in the virtual space, so I can be a doc here in Seattle and potentially care for you in New York if you ever needed anything, President McBride, that's allowed. Washington to New York across state lines in the virtual space. It was allowed through the pandemic. It was one of those emergency edicts that CMMS allowed. That should be made permanent so we can have more docs, more providers doing more things for more Americans, regardless of where they may be sitting, because so much of healthcare consumption is happening in the home now. And I would argue that's a good thing. And to me, this is our chance to do something that our politics is unable to do, which is provide better access to healthcare at a lower cost, more conveniently. Our politics is just not going to get there anytime soon, but that's where technology can step in.
I love that analysis and that framing that you've just given us, because I often am disheartened by the fact that our politics are not going to get us there quickly enough. But I do think there is some hope in what's happening in technology, and that I think is good news for all of us to take away from this this experience we've just been through. I want to end by asking you to think about something, a little bit of words, some words or advice for our students. Do you have any insights or thoughts for young people now who are really coming of age at a time when they are getting ready to go out and make their mark on society at what is an extraordinary moment in our history? The pandemic, this incredible mainstreamed racial reckoning that's happening in our nation, a really fascinating and unprecedented presidency under the last administration, ending in an attempted coup on the nation's capital, and now war in Ukraine being led by Russia. So.
Yeah,
it's a complicated world, and one that, again, just even a few years ago might have been unimaginable. As you think about the last couple of years, what advice do you have for our young people?
You need a different skill set, in my mind, than maybe people were thinking they needed 20, 30 years ago when they were coming up the ranks. So if you're listening to this, even if you know you want to be a lawyer, a doctor, business person, you name it, educator, number one, you need to have excellent communication skills. I learned this later in life and took communication classes when I was in my public policy degree, but that was very much towards the end of my training. And I can't tell you how important that exposure was to me. And I'm constantly trying to become better. But becoming an excellent communicator, making something that would otherwise be complex to somebody that doesn't understand your industry, making that simple, being an accessible communicator is a strongly correlated to success, regardless of your chosen career path. So intentionally seek out skills of communication, take those courses. It will pay off more than you'll think it will when you're in the midst of taking the class, because some people will think, well, gosh, isn't communication common sense? No, it isn't. I say this because this is my profession. What pre-medical students think they should do to get into a good medical school and then have a successful career versus what skills are actually correlated to being an excellent clinician, there's such a gap. And there's a lot of dogma accounting for that. So push back against dogma, stay authentic.
As always, your advice, your counsel, as it has been in so many ways throughout this incredible pandemic we've been living through, is sound and much appreciated, my friend. Dr. Vin Gupta, thank you so much for being with us today and for all that you do, and that we hope you'll continue to do.
Thank you, President McBride. Such a pleasure to be with you. Thank you for the invitation.
The pleasure's ours.